Record. She says, be right there. Perfect. Hey,
Hi, how are you?
good. How are you?
Good.
Good to see you.
You too. I'm excited for this.
Yay, I am too. I'm so glad that you could chat for a little bit. Um,
Yeah,
I know you do have to hop off for, I can't remember. Are you seeing movement clients or are you seeing your
behavior
clients?
clients.
Yeah,
Yeah. Yeah, my weekdays are pretty jam-packed with them at the moment, but
yeah, yeah.
yeah. We're squeezing in movement. I have two or three people that should be starting, so I'm excited for that.
Nice. Yeah, that's so exciting.
Yeah.
Um, well, I'm so glad that you could get on a chat with me, and I have some questions, so I guess we can just see how much time we kind of have and we get through. But mostly, kind of selfishly, I wanted to talk to you, and then I was like, well, why don't we record this because other people might be interested.
Yeah, I think that's a good idea.
Um, I had I guess this was like summer of 2024 now. I had seen a client for massage and she's a myofunctional therapist. But she was
Cool.
coming to see me for massage and so just through the 90 minutes she was on my table, we got to talking and she was really interested in what I do and I was really interested in what she does. So she actually came to my house and we did a session. Um and she doesn't normally do that. She was like, normally I have like a progression that I do with people, but for you, because I know you, like, let's just kind of do an overview. And she had, I learned all of this stuff in this one session, and I was like, this is crazy. This is so interesting. And she um, had recommended a woman who does TMJ massage and is also a myofunctional therapist. So early last year I had met with her, received a session mostly to see like what is this like? Is she legit? And it was really helpful and I kind of was validated through some of the stuff that she told me. And we've just kept in touch. And then it's been a few months now, but so through her myo work, she's seeing clients in person and online. And she's really interested in what I do with movement training because she has said a lot of these clients are doing myofunctional therapy and a lot of them are getting the tongue tie release and have said that they feel like they almost have to like relearn how to move like their body like their whole body feels different. And
Yeah.
so we met up a few weeks ago over lunch and she was asking, hey, maybe we could do a trade of sorts where I can learn more about your work, you can learn more about what my work, and then I ultimately would like to refer clients to you where they would do the Maya work with me, and then kind of like the more broad, holistic movement stuff they would do with me. So this is all kind of like, in the works happening. So I wanted to talk to you just to kind of hear more about like your story getting to myofunctional therapy and then getting to your tongue tie release and then kind of like how things felt. So if you don't mind, like
Yeah. No, this is
overview.
so cool. I love that like this has happened and that you're like diving into it. I think that's so cool. Okay, where do I start? I guess I'll give you a little bit of the backstory. So in middle school, I had retractive dentistry done where they pulled two teeth from the top and two teeth from the bottom. They did expand my mouth a little bit, which also I think just goes to show how narrow my palate was. Um, and they expanded it a little bit and gave me braces. My teeth were very straight, but I didn't know until I remember going to the doctor in high school, I think, maybe even middle school, with complaining about headaches, like every day. And there was like no, it happened basically at the same time every day, but there was no clear cause. They really didn't have any reason for it. It was just kind of like, well, I don't know what to tell you, which I feel like is a large experience that I've had, a recurring experience that I've had with doctors, where it's like, I don't know what to tell you, kid. Like, you're gonna have to live with
Yeah.
it. Which I guess is kind of why I am where I am because I've had to find my own answers. Um, so college, my sister actually had also palatal problems, and she started seeing a dentist, orthodontist, surgeon guy in Virginia. So she was like traveling really far. She went through an intense jaw surgery. Like seeing her go through that pain after, like absolutely not, no way. Never. I'm
Yeah.
not thinking that. And so I actually went and saw him because my mom suggested it, like remembering that I had jaw pain. Um, and he, bless his heart, he does not have good bedside manner. So he basically told me that if I didn't do anything, I would have early onset degenerative bone disease and by the time I was 40, it would look like I had no jaw. And well, he said I would have no jaw. And I was like, fabulous. I'm in my second year of college. Not at all what I want to hear. I do not want to deal with this right now because it would have been like a total, like, what he wanted to do was no, I wasn't ready for it. Um, so I waited a few years and then my sister actually started going to a different, I guess they're orthodontists, a different orthodontist that was closer to where we lived in Pennsylvania. And so that I ended up seeing him and he was much nicer and he had actually worked with the previous guy. And I decided to go all in and do palatal expansion. So this was the first time I did palatal expansion and it was so worth it. Um,
Mm,
so
okay.
they did the expander and my like I have before and after pictures and I look very different. The headaches went away, my breathing got a lot better. I had more room in my mouth. I like was starting to be able to, one thing I asked him that he was like, I've never been asked this before, but like, yes, I think so. It's hard for me to roll R's and like I couldn't roll my R's at all. And I felt like it was like I didn't have enough space for it. And he's like, I was like, could I do this after all of this? And he's like, you should be able to. So that was cool. I can now. It's just really hard for me. It's like a skill that I just need to practice. But I now I have the capacity. Um, but I was also planning to move to California, so I kind of pushed it and went a little faster than I should have. So I didn't fully finish it. It was kind of where it was like, ah, it's good enough.
Yeah.
So he reopened the space on the top, but the thing is, opening the space on the bottom is much more difficult.
Mm,
And that is generally where you need the surgery. So
okay.
the space on the bottom, like my jaw on the bottom, I feel like is probably very much the same, but it's only possible to expand so much on the top because you still have to align your bite. Um, so it was good enough for a few years, and then I read the book Breath by James Nestor. And at that point, I was like, I need to finish this work because I was realizing all of the things like with my airways and other problems that I was still having, where I was like, it's not quite where I need it to be. And like, I could even see it physically. So I found a guy in California. And eventually I went to meet with him and he actually did an x-ray of my airways. And that was like
That's
really,
cool.
it was really cool, but it was also terrifying. I kind of broke down seeing that X-ray because basically it shows colors about like the like basically if it's good or bad, like the amount of space you have in your airways. And a large portion here was black, which was like worse than red. It was like
Yeah.
you are at risk for collapsed airways. Um,
So were you like very like was were things very like pushed forward? Is that like part of
Yeah,
like, in
I've
contrast?
always been really self-conscious about my side view. I still am. It's still not like, and this is like still a thing that I'm going through, I feel like. Not I feel like it is. But yeah, I was super far forward.
Mhm.
My jaw was pushed back, like smashed back, especially before the first round of palatal expansion. My eyes were also pushed back a bit, and it was like I would have more like circles under my eyes too.
Mhm.
Um, and then this time it was considerably better than it was before, but with the x-ray of actually seeing where my airways were, it was really scary. And again, he was like, yeah, this was like an older guy. So he's like, you have three choices. You can, and he's like, also consider quality of life because I was like, I did not want to go through a full 2 years of braces again because this would have been the third time doing that in my life. And like, it's like two
No.
years every 10 years with braces. Like, I don't know.
Yeah.
And so he's like, think about your quality of life and what is important to you. So one option was surgery. And he's like, regardless of which path you take, like you need to recognize that surgery may be something that you end up having to do in the future. And so that surgery, they cut your jaw, space it apart to move it forward, and put like metal to hold it together. He's like, it's like a 2 month recovery. Um,
Wow.
yeah, super intense and did not want to do that. So, and even with that, I would have needed braces again. And then the other option was palatal expansion again. And he wanted to do it with regular braces. And then the third option was to try myofunctional therapy and see where that took me. So I started there. Um, it made a really big impact, but because I was also still wearing my retainer, it could only do so much. It like, because I do
Permanent
think
retainer?
I had a permanent retainer in the on the bottom, just on the very front. But I still like I wanted my teeth to stay straight. So
Oh,
I
yeah.
and also from the first palatal expansion, they made like I have gaps in my teeth up here that ideally it would have been a big enough space to put like implants. But
Mhm.
because I pushed it a little bit, the space didn't get quite that big, and so it would be like I had other options, but like they're expensive and it's maybe
Yeah.
someday. But so without something holding that space there, my teeth would have shifted if I didn't wear my retainer every night. Even
Okay.
now, like I wear my retainer every night. So for the or the myofunctional therapy, she was talking so much about your tongue resting on the roof of your mouth, and I kept biting my tongue because it didn't fit.
Yeah.
Yeah. So I have seen like over time if you do this enough, and personally I think if you target the whole body that you can expand it yourself, but that would involve not wearing the retainer, which like was a risk I wasn't really willing to take. So this orthodontist actually retired, and the guy that took his place was willing to do the palatal expansion with Invisalign. So I did most of the myofunctional therapy. I got like 3 months to the end, and then I decided to pause it and go back in and do palatal expansion again. And then during the myofunctional therapy is when I got the tongue tie release. And then um, after the second round of palatal expansion, I went back and I finished the myofunctional therapy. So it's been a very long process. And
Yeah.
we're still not like I have a mirror right here. Like I especially lately, it's interesting because the pictures from the Primal Summit, I noticed there's like I had actually already been noticing this like in the mirror, but in some of those pictures, I especially noticed that my head is still pretty far forward and I've like developed like a little bit of like a double chin even when I'm not like looking down or anything. And I was like looking too, and I was like, I feel like I literally like some people have really long chins. I've been like really noticing this lately. And I was like, I don't like where'd my chin go? I don't even have it. But it's like a postural thing.
Mhm.
And so I've been like working, going back to the myofunctional therapy and trying to pay attention also to like my whole upper body, like making sure that I'm not like hunching like this because we do so much of the decompression breath where we are like kind of doing this, but you have to like also be in this position. Like you should be like when we did a lot of the like lat pull downs, that was really hard for me because I don't work that path. And I
Yeah.
think it's all related.
Yeah.
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 That was a really long answer.
Oh, no, 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 that's awesome. That's like exactly what I wanted to hear because that helps me kind of like learn about your history like up to this point. So you said you had the tongue tie release while you were going through myofunctional therapy. So when it's 2026. So when did you have the tongue tie release?
The tongue tie release probably would have been 2022, somewhere
Okay.
around there. I think maybe 2021 actually.
Okay, so it's been a
Yeah.
few
So it's been
a
about five
bit
years.
a bit. So before you like got the tongue tie release, did your any of your practitioners say like, "Hey, we've identified you have a tongue tie"? Like, was that something that
Oh,
you knew?
I had no idea. I have a lip tie like as well. I have never, no dentist, nobody has ever mentioned that. I didn't even know what it was. And
What's a
just
lip
from
tie?
It's like similar where you have it on the top where it's also there's like
And
I don't know, is it extra skin or what? I don't even know what I don't even know what it is. I don't know what I had done. I just know that it's something that's holding it down and
okay,
so it like limits your movement, like your tongue's movement for that, but this would limit like your I guess your lip movement.
wow, okay, didn't know, but that was
Yeah,
so you found out that you had a tongue tie then.
during myofunctional therapy.
Someone told you you had a tongue tie.
Yes, I had no idea. I didn't even know what it was. And when I did the consultation with her, she like asked me to like, I think she asked me to open my mouth and like lift my tongue up and stuff. And she's like, "Oh yeah, you have a tongue tie." I'm like,
Yeah.
"What? Cool.
Yeah.
What
Okay.
is that? What do
Yeah.
I do?"
Yeah. So I find this really interesting because um these two women that I have seen both told me that I have a tongue tie. A grade
Ah,
two tongue tie. And so I've been kind of like playing this in the background a little bit, like, I'm not really ready to do anything about it, but like at one point, like there's there's other things going on. And so like hearing your story is it's interesting to me to hear and to know also that they had kind of given me sort of an overview of like time back into like the 80s where like they used to look for tongue ties in the hospital and then they kind of stopped like assessing for tongue ties when formula came into the scene. And so the first woman I had met with, she was a lactation specialist and then became a myofunctional therapist. And so she deals a lot with like infants and little kids. And she was talking about how like the latching, like being able to breastfeed often, not always, but often is related to that, like
mhm.
being able to suction the tongue and the tongue tie. And if, not like the mother's fault, but like babies not being able to breastfeed, like they would just be like, oh, well, we have formula. And so like it would just be kind of like overlooked. And so I learned all this stuff from her. And so it's like, oh, well, it makes sense that like people would have this and not really know. Um, Especially if
Yeah.
it's not like an aggressive tongue tie. Some people have a tongue tie where like they can't basically like can't even like fully stick their tongue out of their mouth.
Yeah,
Like,
I had a client that had a very clear tongue tie, and I was like trying to tell her mom, like, this is why you can't understand when she speaks. Like, she can't move her
yeah,
tongue.
yeah.
I don't think they ever did anything about it because it's out of my scope of practice. But
I mean,
I
yeah,
tried.
do what you can.
Yeah.
Yeah, so you had the tongue. So I know in our message you, or I think in Slack, you were talking about how you had the tongue tie release and it was like pretty like
It was
profound.
so cool. It was so cool, Jen. It was the coolest thing ever. And like I think that the thing I liked the most is that they were like surprised by my reaction. I think he said they've heard things like feeling like a full body high, that sort of thing. But apparently now they use this story when people come in and get it, is like what I told them. I knew immediately when he did it because obviously you're numb, so you don't feel anything. And he didn't tell me when he was going to do it, but I knew immediately because my toes started to tingle. And
That's
then it spread throughout the rest of my body. And I was just like, what the fuck? This is so cool. It was just like I felt so light and like like I could like move and I don't even know. It was really
free.
that whole yeah, free. That whole body high is really just like the best description I feel like I can give. But immediately in my toes. And I've learned from actually like another doctor that maybe I just have like a really strong awareness of like that like line of I don't know if it's a line of tension, fascial line, whatever it is, because I also I had to get like a numbing shot in my foot. And immediately when that went in, my airways cleared up and I felt it in my head. And she was like, I was like, is that normal? And she's like, no. Like, I don't know what to tell you. Like
That's
when you
wild.
play when you mess with my feet, I feel it in my head. When you mess with my head, I feel it in my feet. So there's some kind of like there's something that connects there.
Definitely, it's yeah, I mean, as you know from just doing this work too, it's definitely connected. Um, so when I spoke with these myofunctional therapists, one thing that they told me is that not everybody is instructed to do myofunctional therapy when they do their tongue tie release, which is crazy.
Yeah.
And they were telling me that a lot of people have this, maybe not like they're maybe not as aware as you are, but they have this feeling of like, oh my gosh, like I had all this tension and it's like gone away. And then it's very short-lived. It's like maybe a couple of weeks. And then the ones that don't do myo, it kind of comes back.
Yeah. I actually like I can account for that. My therapist also told me something similar. She said like she had a client that was little, the mom didn't follow through with making him do the exercises and it grew back worse. So
Oh
it
no.
was they
Yeah.
he couldn't it was hard to understand him speak. And it was because they didn't do the exercises. I am an anxious person. And so I'm a little like, I don't know if I did enough. Like, part of me feels like mine grew back a little bit. Like, because I couldn't even really see it before. So I don't know. Like, looking in the mirror, I couldn't tell you. She said everything looked good, but I have a little bit of paranoia because it did feel a little short-lived. But I also have so much going on in my body that I think it was just a layer
Mhm.
that because it was so like acute and profound that I did feel it really well when it happened, but then
Yeah.
that layer passed and now my body is like, okay, on to the next thing. Let's get with this next line of tension, like this next thing that's bothering you, because like that one thing doesn't solve all of your problems. It's just like a step in the right direction. So I kind of think that's what happened with me, but I
Mhm.
do get a little paranoid that like, oh, maybe I didn't do the exercises well enough and like it grew back.
But you're not having the same symptoms that you were having. Like things are continuing to trend in the
You
right.
know, the symptoms, like, I don't think I was even really aware of the specific symptoms that were related to that. So I couldn't really tell you. I do think there was a lot of tension in my upper back and my neck, especially. And like thinking back to how it was, I do think that is what resolved it.
Yeah.
So
Cool.
yeah, that hasn't come back. But I think I just didn't really know exactly what the tongue tie was doing. It was more of like I went in having no expectations and felt this just incredible release and lightness and like freedom. Um, but I do, now that I'm thinking about it, I do think it was like kind of like back here, there was a lot more tension. So that makes me feel a little better. I think you're right.
Yeah. Yeah, it makes sense that it would be like you said, like, you're peeling back layers and rarely is there like one thing, one exercise or
Mhm.
one procedure or therapy that, solves all the things. Like we're
Yeah.
complex. Um, but that so the tongue tie release happened. You did your myofunctional therapy. I'm curious to hear then how your body felt, like how moving felt different. And I mean, having less tension is going to make you feel different, certainly, but like, yeah, how did that change things for you? Like, did you have the experience of like, oh, I feel like my gait is different, or yeah, I don't know.
I think at that time I didn't, I was still in, there was like a time from somewhere around like 20 to really when I met Bam, where I really disconnected from my body because I had so much pain. Um, it was like if I really paid it, because like I have the capacity to feel everything, I feel like, in like all of it and like attune to all of it and pay attention to all of it. But I was in a place where because of like my gait and all of these like the tongue tie and everything where I had pulled myself back because if I focused on like if I paid attention enough, I would have been miserable all the time. So I'm not sure that I actually know like I can like think back retroactively. Um and I do feel like I felt looser and like more flexible after it. But
Mhm.
I wasn't paying attention and I didn't know enough about gait to like really know if that impacted how I walked and how I actually like moved forward. I was doing yoga at that time and I do feel like I felt much more flexible after that. I don't
Yeah,
know if it showed up visibly, but in my body, it felt like I could do more things.
yeah,
Yeah.
cool. Yeah, that's something I'm interested to hear about and learn about more from people, because I think there's, like, to your point, when you're having pain or you're having so much discomfort, like that's often like you cope by like I'm gonna disconnect from this. I'm gonna try to not feel what's going on here so that I can get through my day, or to not have it be taking over your thoughts. Like
Yeah.
I mean that's like that happens to people. And so I wonder, yeah, how, when I think about this myofunctional therapist and her clients who are getting tongue tie releases and feeling like, oh, maybe they're much more aware of their body post tongue tie release than they were before, because they had like kind of numbed some, you know, I don't know. Either way, I mean, I think people they need the movement work. Like everyone needs it some
Yeah,
way. Uh,
definitely. Well, I mean, I do, now that I'm thinking about it, like I do remember, especially immediately after feeling really different in my body. And I think because of growing up dancing and then doing yoga, it was something that like it wasn't, it didn't stop me from moving. It was something that I just kind of went with and explored, but I could see if it was somebody that doesn't really have that experience of being connected to their body. And then all of a sudden they're getting this whole release sensation. And then you might not know what to do with that after.
yeah. Yeah, totally. Yeah, this definitely has some gears turning for me, because I think um I could imagine even like all of the decompression work that we do, and kind of like the myofunctional therapy and the decompression work kind of working together. Um, and I'm excited and eager to work with new clients, but I also think there's, as always, like not everyone's ready for the work that we do. And I'm even thinking through like how I can even help this therapist, like even just learn some of the decompression work, to be like, maybe you can just like pepper this in with the myo work that you're giving your clients, and like, you know, maybe
Yeah.
that's like enough to kind of get people started, or at least, see like, do we want to deep dive into this or not? I mean, I always think that there's like more that people can be doing. But yeah, I mean, it's interesting when there's like a new adding something into your life, I feel like tends to be a like a challenging thing for most people, which is like why compliance is such a thing. I'm noticing. I'm sure other therapists, physical therapists deal with it too. Like, um, oh, now there's this, I need to suction my tongue to the roof of my mouth 30 times a day, or, finding when do I do this, finding the time to do this. Well, if they're already doing that, yeah, I'm wondering if there's like, maybe there's this seamless transition to doing that work and like
Yeah.
some of the movement work with it.
I I feel like for my myofunctional therapist, she did a really good job of building in like behavioral strategies, which like as a behavior analyst, I really appreciate. Like she would give little things to make it more of like, so like for example, one was like, okay, what I want you to do is every time you think of like, she was like, pick a color. And I was like, orange. She's like, okay, every time you notice that you're looking at the color orange, I want you to check if your roof is on the top of your mouth. And so, like, for the day, every time I remembered that I was looking at orange, I was like, okay, where is my tongue? And she had me draw a picture that had a rhyme that's like I think because I did a lot of hot yoga then, it was something like something about yoga when it's hot. And then during my classes, they would always say, when we inhale, we rise. So I put like, when we inhale, we rise, like my tongue to the spot, because she would call it like the spot. And so
Mhm.
she's like, okay, I want you to put that picture up, like where you're going to see it every day. And so it's getting like, kind of like subliminally getting it in your head to think about like, where is my tongue? And so I do think about it rather often still, like, is my tongue on the roof of my mouth? Um, but for actually doing the exercises, because it's like 6 exercises 3 times a day,
Yeah.
a lot. I did a lot. I drive a lot for, especially at that time, I was in grad school and I was working like 6 or 7 days a week. And so I would be driving a lot. So I did most of my exercises in the car.
Yeah.
Or like while I was studying, I would like multitask.
Yeah. When you talk about that, that therapist kind of almost like having these visual like hooks for you,
Yeah.
it makes me think about, the stuff that we do with movement where it's not, obviously it's not just about doing rockers, but checking in with your feet,
Hmm.
checking in with your hips, like, how you're standing. And I feel like it's a very similar thing, especially when people are starting this stuff, where it's almost like you do need that little like hook to kind of like remind you and pull you back to where, okay, well you do that long enough or you like see orange for, every day for a month, like after a while you don't have to think about it so hard and you're just,
Like
doing the
automatic.
recode like
Yeah.
integrates into your life.
Yeah.
So yeah, I'm just thinking about like how that latches, how that makes sense for people.
Well, I feel like it's also similar in that, a lot of the things for primal movement are we incorporate it into our, like, it's the environment is so important. So, like, making a space where it's easy for you to access that you have all the space to move on the floor, or setting up a floor desk so that when you are doing things that typically you might be like hunched over, you're giving yourself um, a better environment, but like you're kind of setting yourself up for success, because if you sit on the floor versus sitting in a chair, it's much harder to like slouch or to sit in your front chain. And then even like how a lot of us have switched up our beds, like that's something that the initial thing takes effort, but once you do it, it sets you up for every night to be completely like
Just how it is,
decompressed.
how I do it.
Yeah.
Yeah.
Yeah, so it's like also in behavior analysis, like environment plays a critical role in our behaviors. And so I think this therapist also really used that because she would also tell me like you can put up post-its, you can put up a reminder on your phone, you can set alarms throughout your day, and those are all environmental manipulations that take less pressure off of me to remember like, oh, I need to be thinking about this or doing this. It's like setting yourself up for success, and I think that's a lot of what we do with primal movement too.
Yeah, that's a really good point. Yeah, I know like you probably gotta hop off of here
I
pretty.
have I have like 10 more minutes. But I did have one more thing that I think is really important for the myofunctional work and all of this, because this is something also that like it's not that I didn't know, but I'm really learning, especially now as I'm at this stage in all of this, um, is just like the importance of like the decompression breathing and learning that like standing and sitting posture and the alignment of all of this is so intertwined with all of this.
Mhm.
Like I really feel like you can't have one and not the other because even like so I completed the myofunctional. I mean, the last time I saw her, she wanted me to do like one more month, but it was like a really busy season and I felt a little bit judged because it wasn't exact. She basically was like, "You're not exactly where I'd like you to be." And so I like felt a little judged. But also, I don't think with that alone, I could have been exactly where she wanted me to be because it's such a full body experience. Like I really don't think you can do just this and not address this and have it maintain. Because I feel like after that, like stopping doing the exercises all the time, the pain came back. And so then I would have to go and do the exercises again. So it's kind of similar to physical therapy in that it's targeting the specific area that's causing you pain. And when you're doing the exercises, it can relieve the pain and support you and do all the good things. But unless you're addressing the whole body, it's not going to maintain. It's not going to last.
Yeah. Yeah. I think that is what this woman who's wanting to refer clients to me, I think that she like ultimately knows that and understands that, and I really like her and appreciate her for that reason because like sometimes we need like a team. I don't for like lots of different people's bodies and issues, like you end up working with, multiple practitioners, or you learn things from different schools of thought. And so I just appreciate that about her because I think it's like, oh yeah, we can work together here. And knowing that okay, you can work through the TMJ massage. Like what she did was like so crazy and so awesome. And then the Maya work, and then like zooming out and thinking about the whole body and the breathing. I think they do a little bit of breath work stuff, but it's not really like a highlight of the myofunctional therapy. I'm sure every therapist does things a little bit differently, but
Mm.
as you know, that's a huge piece too. Like how you breathe influences your posture and vice versa. And so,
That was like a big thing actually when I got the pelvic expansion the second time, and we were talking about the x-rays. I was kind of like, you know what? I think I want to just try breath work and see where that takes me with opening up my airways. Like, I don't want to jump into a surgery. I want to try everything else first and see if I can at least get to a point where like I can avoid it. Like even if it's not perfect, at least like I have a good quality of life. And so like I'm still on that journey. Like there is probably still I haven't seen x-rays now, but like I would imagine it's better, but I'm still at a place where like that could be in my future. But I think there's that addressing everything is honestly even better than the surgery because again, that just targets one thing. It doesn't
mhm.
target everything.
Right, like if you did do the surgery, like there's still work that you need to do to
Yeah.
maintain or to, rebuild, yeah,
Yeah.
I mean, it wouldn't be like where things end is surgery and then now it's
Yeah.
oh,
And I feel like they like tend to pose things like that. But to speak to also like how collaborative your myofunctional therapist is, I wonder if that's like because I feel like mine was as well. She said they held like basically these like collaborative calls every Saturday morning where like
Cool.
myofunctional therapists, orthodontists, like pediatricians, different types. She's like, do you want to come on for like behavior analysis? Sometimes we work with kids with autism. And at the time, I was like, my mentor was really strange and she was like, you shouldn't do that. And so I listened to her, which was dumb. Um, but like, I'm wondering, I feel like probably a lot of people that are doing that are really seeing like that you have to address everything, you have to collaborate.
Yeah. This woman, she hasn't talked about any collaborative calls, but she's been in chiropractic offices and pediatrician office, different dentists working not just just with mouth specialists, but kind of yeah, like all different realms of work. And I think it's cool because she's been able to see, oh wow, so many people need this work. And I think also to see what her work is. Because I think a lot of people just don't even, they've just never even heard of it before,
Yeah.
before I initially saw this woman as my massage client, I had never heard of that before, didn't know what myofunctional therapy was. And now it's funny because now I have seen a number of clients who have talked about either going through it or that they're going to start it or their kids are going to start. And so I'm like, okay, this is cool that people are getting support and it's becoming more like normalized, which hopefully is kind of like the same thing for primal movement. It's just going to become
Yeah.
something that people like talk about, just, you know, not this like, what? What words did you just say? Um, but yeah, I think, you pretty much answered all of the questions really that I had that I wanted to ask you about. If I
So,
think of anything else, I will reach out.
yeah, please do.
Do you have anything else?
I don't think so. Again, I love that this was like brought. Oh, actually, I remember seeing. I didn't fully dig into it because like it didn't really apply to me because I had already done the tongue tie release. But there is somebody on Instagram that I follow that I remember her posting something about like say she said something and she had reasoning about ways to avoid it for kids, where like I guess because a lot of people, and probably I'm assuming, it's because of people doing the tongue tie releases for babies, and then obviously they can't do the exercises. So how much does that even really help? I think she focuses on a lot on just like open posture, like she doesn't put her kids in strollers and stuff like that. But so there might be more. I can send you her Instagram. It's Corey Malloy. Um,
I'll write it down. I'm not on Instagram right now, so I might
okay.
find another way.
She has a
Corey.
website too. And a podcast. So I'm sure there's probably a podcast where episode where they talk about it. So I
Okay.
can send you that information. But I remember seeing that and being like, oh, that's interesting because I've already done that. But like you're saying that maybe there's different ways to address it for kids than going right to like the scissors.
That makes a lot of sense to me.
Yeah.
Like, if you can't really do the therapy around it, I mean, I don't know enough about that if doing the tongue tie release and then like breastfeeding
You
is
would
like
think that might be enough.
part
Yeah.
of it, but yeah, I'm sure this person probably has some information we could
Yeah.
learn.
Yeah. So I can send you that if you're looking for any more information.
Yeah,
Um, I
awesome.
steal a lot of information from her. I like her.
Cool. Um, do you once I like upload this, do you mind if I share it in the Slack?
Yeah, feel free. You can share it wherever.
Cool.
Yeah.
Awesome. Well, thanks for being able to chat. I'm so glad
Yeah,
I got to
gladly.
learn more about your story and all that.
Yeah, thanks for asking and for listening.
Cool. Well, have an awesome evening, afternoon, and I'm sure I'll chat with you in the Slack channel.
Sounds good. Thank you, you too.
Bye.
Bye.